Hi, this is Dr. Aaron Montgomery. I'm an interventional radiologist here in the Florida Panhandle. We're having a beautiful day out there. Today I was going to talk to you about pelvic congestion syndrome as well as varicoceles. What these are essentially the same disease process, however they affect the sexes differently. What is going on is we have a vein called the gonadal vein, which on the left side, it comes from our left kidney vein. And what can happen over time is that vein can dilate. And when the vein dilates, the valves get stretched apart. So the normal way that blood is coming back from the pelvis goes up through these valves close and it works its way up. Well, in this case, when the vein gets stretched, those valves don't work, so all that blood goes right back down and it engorges the pelvis or the veins around the testicle. So varicoceles are dilated veins or varicose veins essentially around the testicle. They can cause severe pain. They can also cause sterility. In females, this is called the ovarian vein. It goes down and it engorges all the veins down in the pelvis, and it can cause pelvic pain, pelvic pressure. It can cause back pain and pain during intercourse. Some women will also have large varicose veins extending through the pelvis and even down into the leg. So this is not a new finding. This is something we've known about for years, but the treatment options have not been readily available. Now what we have is embolization techniques. So we can go in to the vein, we use ultrasound to guide ourselves into the vein, we run a catheter up, we get into the vein that's draining the kidney, inject the dye, and watch that it is in fact going the wrong way. Once we see that, we can engage that vein and we can put in drugs that irritate the vein, as well as these little coils. And they're called coils because they look like a little spring, a coil. And those embolize the vein. What embolization means is basically we put a plug in there. The patients often say, well, how's blood going to get back? Well, it's getting back somehow because it's not using that vein. What this does just stops the engorgement. It gets you out of pain. The results are essentially immediate. Had one gentleman laughing on the table when we did it because it no longer hurt when he would flex his stomach muscles. So it's a simple procedure. It's very easily treated. There are women out there that have gone through so many different procedures, and when in fact it was just pelvic congestion syndrome and it was fixed in 15 minutes. So if you're suffering for that, we hate to hear these stories of these patients being around to different doctors. But if you have it, you know somebody that may have it, give us a call. We'd love to see you. Thank you.